So I usually start seeing patients around about 9. But right now, I think there's an early patient, so I'm going to be seeing that patient now, and then I'm going to start seeing so the patient I'm going to see now is not booked for today. They were actually booked during the week, but they didn't come. So I'm going to start with them today, and then I'll start my normal routine at about 9. And yeah, when we're done with the echo, we do report. So we have to file everything for future reference, obviously. And yeah, so I'll probably show you what echo looks like. I'll try to find an echo that doesn't have patient details, and then I'll explain some things, some components of echo. Yeah, that's it. So we don't usually see like very, very sick patients here in the practice, but you do get sick patients in the hospital. So we actually also work in medic clinic for inpatients. So the doctor here sees inpatients and outpatients, but in this practice we see outpatients, and then at medic clinic we do see inpatients under his care as well. Yeah. Okay guys, so I just finished my first echo this Friday. So this is the patient. I think I saw this patient last year when I was still working here full time. Yeah, last year around about October. So I just did his ECG and his echo. He's fine. It's fine. So I said I'm gonna show you guys I'll find an echo that doesn't have patient details for patient confidentiality, and I will show you how the echo looks like. It's just for education purposes. Yeah, I'll just find a normal echo just to take you through it. I don't know, hopefully I'll also find another one with pathology, and then I'll let you know what pathology it looks like it is. And yeah, otherwise I'm also waiting to see about I'm still waiting to see about 5 booked patients for today. I think only one patient is only booked for an ECG, and the rest are actually echoes and ECGs. Okay, so yeah, today is Friday. Hopefully we'll knock out early today, because we usually knock out a bit earlier than the rest of the week on Friday. I think around about 3:30, because we usually knock off at 4:30 towards 5 if there's a late patient, obviously. And yes guys, so when we're done with the echo and the procedures, we file the results for future reference, as I mentioned earlier. And yeah, for now, because I'm still waiting for a patient, I'm just gonna make coffee. So now this is the ambulatory ECG machine, or just simply a Holter device. So with appropriate indication, the patient actually is allowed to take the device home for 24-hour monitoring. But there is also other Holter devices that are like 5-day monitoring devices. Some of them are like 3-day monitoring. So there's quite a lot of these subtypes of devices here. So here, the patient actually had, I actually hooked this one up yesterday, and now the patient came back. I'm about to analyze it here, as you can see. So this now is the tool that I use to put this SD. So this SD actually comes from that device. So it has a recording. I'm gonna extract that recording, and I will actually analyze it on this computer here. All right. So now this is my computer. It's trying to read the data, and then when it's done, I'm going to analyze it. So I made sure that I got an echo with no patient details displayed here. So this is a long axis view. This is the left atrium, this is the left ventricle, this is the ascending aorta, this is the aortic valve, and this is the mitral valve. Okay, so here you can see the nodule, the calcified nodule in the posterior mitral valve leaflet. This is the anterior mitral valve leaflet, and this aortic valve is thickened. You can see it's very bright and thick cusps. So this is with color. So you can see this blue jet coming from the aortic valve showing diastole. That is aortic valve or aortic regurgitation. And there's no mitral regurgitation there. This is a color Doppler. And here we measure the aortic root diameter and the left atrial diameter. And here you measure the left ventricular ejection fraction, as you can see. And this is the RV, or right ventricular inflow. So this is the right atrium, this is the right ventricle. And then there's a tricuspid valve here. And then this is a trace of the tricuspid regurgitation. And this is short axis view. So you see that aortic valve that is thickened. You can see it's thickened and calcified aortic valve. And this is the left atrium, this is the right atrium, this is the right ventricular outflow tract. There is a right ventricle here, and there's a right ventricle here, there's a tricuspid valve there. So right atrium is down there. And here you will usually see in a better image, you would see a pulmonary trunk here, and then it splits into right and left pulmonary arteries. So this is the trace of the pulmonic valve flow. You can still see a bit of aortic regurgitation there. And then this is a mitral valve in short axis. This is the left ventricle, this is the right ventricle up there. This is the septum. There, that's the septum. Again, these are the papillary muscles. These are the papillary muscles right here. And then this is where we measure the left ventricular ejection fraction as well, using the M mode, like that. And then this is a 4-chamber view. You can see the left ventricle, left atrium, right ventricle. You can still see that nodule, calcium nodule here on the posterior mitral valve leaflet. This is 4-chamber view. This is with color as well. We're checking for mitral regurgitation. It's just very trivial, just a trace of that MR there. And then here we're just measuring the EA ratio to determine diastolic dysfunction. Now that is the aortic valve. So this is a 5-chamber view. You can see we opened an aortic valve there. Here. So that's the aortic regurgitation I showed you on the long axis view. And yeah, that's the CW, continuous wave Doppler, to determine the gradient across the aortic valve. And then you can see so this is the forward flow coming down from that left ventricle towards the aorta. So you see it from the midline downwards, so that is a forward flow. And then whatever going from this line upwards, then it is a backflow of blood. So that is regurgitation here. So I was measuring the pressure half time here. And this is a TAPSE, so tricuspid annular systolic excursion. So we usually use this one to measure the RV function, but you definitely get the RV longitudinal function of up and down of the annulus than the overall RV function. Okay, that's the full chamber again. So here I did remeasure the aortic valve pressure gradient again across the valve.